Back now on Triad today, I don't know what could be more important than trying to sustain our communities for the long term. And I don't mean just picking up trash along the road, and that's important. I don't mean just taking the park bus, that's important. But thinking ahead, thinking how we want to plan for how our communities are going to look and how they're going to operate. And two folks here with me that are doing a great job in different areas of the sustainability project. I want you to meet them. Jay Paul, director. Next to me is April Durr. She's director of Healthy Alamance. And of course, she's an employee of Alamance Regional Medical Center. We'll get to that in a second. Garry Merritt is the distinguished president of North Carolina Housing Foundation. And we welcome both of y'all today. How you doing?
Doing well, thank you.
Garry, let me start with you. Remind us all briefly, very briefly, what the Piedmont Triad Sustainable Communities Project is all about, because some people are getting, it's a hard thing to try to get their brain wrapped around when you talk too much in concepts.
Well, it's a 3-year program looking at the future and how to position the Piedmont Triad in such a way that the livable, sustainable incomes where we can replace the jobs we've lost in the furniture, textile, and tobacco industries into the high-tech industries, and the positioning of our employment centers to be able to provide jobs for 12 county regions.
So you're looking at it not just in affordable housing for inner cities and other areas, but that whole package of we want people fully employed, we want them employed in jobs that are high-tech and for the future, and we want them to have affordable housing. It's all connected, isn't it?
It's all about building a community that can enhance the quality of life. And why educate our brightest and send them off somewhere else to live because we don't have jobs in this community to retain our brightest.
Good point. April, what's the biggest barrier that, and I know this is a big setup because I think I know what the answer is going to be. What's the biggest barrier that keeps people in Alamance, for example, from accessing health care? Because there you are, director of Healthy Alamance, and I somehow think your answer is going to have something to do with this whole concept of how our communities are developed. What's the big barrier to people getting health care?
Sure. Well, Burlington is the largest city in the state of North Carolina without a fixed route public transportation system.
I didn't know that.
So that also keeps them from jobs as well as from health care or just getting around their community to enjoy the things that might be offered there, such as recreation and other services. So that's my little green button that I've been wearing.
The green button says, I support transit. And what do you want? I mean, what do you want to happen in the Burlington Alamance area to make it better so that people not only can get the jobs, but if they need to get to doctor's appointments or whatever, what do you want to see happen?
Well, we've been working through a grassroots effort called FAST, which is Friends and Advocates for Sustainable Transportation, and that's bringing together both our residents, our elected officials, and our policymakers to advocate for bicycle lanes, sidewalks, and a fixed route bus system.
You also had something, I think you sent me an email one day, and I was trying to go over it. My eyesight's a little bad, but I try to make a note here. There's a couple things. You've got a food co-op going and a farmers market initiative. What are they all about?
So the mission of Healthy Alamance is to connect communities to improved health, and we look at that a number of ways, primarily by their built environment and by the things that are around them, such as access to fresh fruits and vegetables. Are there nearby stores selling that? And if not, how can we help communities develop a curbside market? Are there recreational activities for kids to be active so that our obesity epidemic isn't going to get worse?
And fresh produce helps to fight obesity. Everything's connected, folks. I mean, look, I don't want to preach about this, but if you're buying produce from California, no offense to California, but you have to spend a lot of energy, a lot of gasoline, and there's pollution involved to get that here. So it's better to go local. Garry, before time runs out, what can people do? I mean, you've explained what this whole project is about, and you did that very well. But what can an individual who's watching say, well, Garry, that's fine. You and April are working on these big picture concepts. What can I do here in my neighborhood? What should I be doing?
Well, we have meetings in the 12 counties, and those meetings are advertised, and there will be several rounds of those meetings, at which time we are collecting visionary ideas, which gives us a lot of vision of different counties of what they see the strengths and weaknesses are. And that's the way you can contribute.
Getting some early input and working toward the future. Up on the screen, www.partnc.org, who helped put this segment on, the good folks at PART. Brent McKinney do a great job over there. Ride the bus, folks. That's my tip for today. Triadsustainability.org is another website to go to. So to Garry and April, thanks for all you do.
Thank you.
Keep me posted, will you?
We sure will.
We'll be right back after this.